In this video, I'm going to show a paper that links poor metabolic health to cancer and also what we can do to take control and help get our health back in order. Let's start with what is metabolic health. Endocrinologist Gerald Reaven coined the term Syndrome X in 1980, which is now known as metabolic syndrome. This is a measure of metabolic health. So metabolic syndrome is a clustering of at least 3 or 5 medical conditions. They are trunk obesity, so basically excess fat around the abdomen, elevated triglycerides, so less than 150 mg per deciliter, low HDL, less than 40 mg per deciliter, elevated blood pressure of 130/85. Next, elevated glucose levels of more than 100 mg per deciliter. So having 3 of these signs would be considered a positive for Syndrome X, or what is today known as poor metabolic health. Ideally, we would like to have none of this. This paper here shows the link between poor metabolic health, obesity, and cancer risk. This paper was published in January 2023, so it's fairly recent. There were nearly 800,000 European participants in this study, and they had their BMI and metabolic health assessed to determine the relationship between these factors and the risk of obesity health by considering blood pressure, fasting glucose, and triglyceride levels. The result came with no surprise. It showed metabolically unhealthy individuals faced a higher risk of developing certain cancers. Metabolically unhealthy women with obesity had a 21% higher risk of colon cancer, 3 times higher risk of endometrial cancer, and a 2.5 times greater risk of kidney cancer compared to the metabolically healthy women. For the men, the metabolically unhealthy men, the study found 2.6 times higher risk of kidney cancer, and 85% risk of colon cancer, and a 32% increased risk of pancreatic and rectal cancer. In this paper, they additionally wanted to highlight how just being obese without being metabolically unhealthy can also increase cancer risk. So women who were obese without being metabolically unhealthy had an increased risk of kidney cancer, while the man counterpart had 67% higher risk of kidney cancer and a 42% higher risk of colon cancer. I hope hearing these numbers actually make you take note of how being metabolically healthy and not obese can do a great deal for you. Let me propose a simple solution. You guessed it, exercise, but not just any exercise. We should weight train or resistance train to build more muscle tissue. The key is really having more muscle tissue, and I'll explain why. Let's first talk about the basics of cellular function and explain the way muscles utilize the nutrients provided through our food intake. Our muscles preferentially uses glucose during exercise. Our body prioritizes burning and storing glucose over fat and protein because if blood sugar level remain too high for too long, glucose actually becomes toxic to the body. So poor glucose clearance in people who are insulin resistant or have diabetes, they end up with damaged tissues of the body, and this raises the systemic inflammation levels. In order to clear away excess glucose, we need the help of muscle tissue, because in muscle tissues where there is an abundance of mitochondria, declines in muscle mass and mitochondria diminishes the body's capacity to store and burn glucose. That's right, you can store glucose, and that's in the form of muscle glycogen. Your muscle will actually take in blood glucose or excess blood glucose during exercise. The contraction is the one that is helping the uptake of blood glucose without the help of insulin at all. Therefore, the chances of you being insulin resistant is lower because it does not tax the insulin system at all. The benefit does not stop here. Muscle tissue also serves as one of the largest sites for fatty acid oxidation. At rest, our bodies are mainly using fatty acids as fuel, thus lowering the plasma triglycerides level. You see how this will greatly improve your metabolic health by improving 2 of the most crucial biomarkers of metabolic health: triglycerides and blood glucose levels. The only way you can grow muscle tissue is through resistance training. There are no two ways about this. Cardio training will not provide the right stimulus. So if you are someone who is new to strength training, then I highly recommend you check out the link to my free PDF, which I have put together a series of strength exercise to improve mobility and at the same time increase your strength. And this PDF is totally free. The link can be found in the video descriptions below. What I have highlighted above is the metabolic power of muscle. It's amazing how doctors are not looking more into helping or advising patients to increase their muscle tissues instead of prescribing drugs to bring down certain biomarkers that they deem to be in the red. Take responsibility of your own health and start exercising. When someone who is sedentary starts exercising, the benefit they get from getting started is crazy. You increase your quality and quantity of your life exponentially, and there are a lot of scientific data for that. As advanced as the pharmaceutical technology is, there is currently no drug in the world that can rival the benefits of exercise. So, take responsibility now and go put in the work. This is Gary from Penultimate Performance, signing out. See you in the next one.